So today we're going to talk about PCOS, polycystic ovary syndrome, and menopause. What to expect when you have PCOS and you're going to go through menopause. What's going to happen? Now this is a question, this was a video topic that one of you viewers recommended that I talk about. And I think it's important because many PCOS patients have no idea what to expect in menopause, and things do change. First of all, you need to understand that PCOS is a metabolic syndrome. That means you have increased inflammation, blood pressure may be a little higher, your hormones are going to be out of balance, you're going to have increased issues with insulin resistance, increased cholesterol level, and a lower metabolism. So maybe some weight issues as well. Now, once you go through menopause, one of the interesting things with menopause is your metabolism naturally lowers, and you may have a little more inflammation because of the lower hormone levels. So PCOS actually gets a little worse in the sense of the metabolic syndrome. And that's why treating PCOS during your premenopausal years is so important. So number one, what are you going to do and how are you going to address it? First, you want to address inflammation. PCOS is characterized by a high cardioreactive protein, or CRP. You tend to have high small LDL particles, which are more likely to cause arteriosclerosis or heart disease or stroke, and lower levels of large protective HDL particles. Your hemoglobin A1C tends to be elevated because your blood sugars tend to rise a little bit higher. PCOS and age both do this. So as you get older, go through menopause, and if you have PCOS, you're going to have these inflammatory markers. You can deal with these inflammatory markers by making sure that you're getting your hormones in balance and you're balancing out that hypothalamus of yours. It's controlling all of your hormones. Number two, you need to correct the menopausal estrogen deficiency. That is really key in trying to control some of the inflammation from PCOS. PCOS is a very androgenic condition, meaning that you have more male hormone active than female hormone. And that can cause the hirsutism, the hairiness that we see, the whiskers. It can also cause the increased weight gain that we see around the middle in PCOS. Both things that happen in menopause as well, because testosterone levels become unbound because of the lower estrogen levels in menopause. You're making less testosterone than you did when you were younger, but more of it's unbound, more of it's free to cause things like chin whiskers, which can make PCOS symptoms seem like they're worse. So correcting the estrogen deficiency, that may mean bioidentical hormone replacement therapy in order to get your estrogen levels up to where they need to be in order for your brain to stay healthy, your body to stay healthy, and some of that inflammation to come down. Now, you cannot take estrogen without progesterone. So both of those bioidentical hormones need to be taken together. Number three, support your hypothalamus. If your hypothalamus is supported early on, before you ever even get close to the menopausal age, you're going to correct your PCOS inflammation. You're going to correct that metabolic syndrome. So menopause is going to be a breeze. The transition into menopause will be a breeze. If it's too late, you're already perimenopausal with PCOS, get started on balancing your hypothalamus. The earlier you start and the more committed you are to providing your hypothalamus with the nutrients it needs, the better hormonal regulation you'll have. It's really important because your hypothalamus controls so many of your endocrine glands, particularly the ones that are affected with PCOS. Your adrenal glands, when you're producing too much DHEA, which is that androgenic hormone that's contributing to the hairiness, and your ovaries, as well as your thyroid metabolism and your glucose metabolism. So supporting your hypothalamus really helps to mitigate PCOS symptoms and actually can reverse metabolic syndrome. And I've seen that throughout the PCOS age range, from early young teenagers all the way through menopause. You can balance your hypothalamus out naturally with Genesis Gold, and you can get Genesis Gold right here. Genesis Gold has helped heal so many of my PCOS patients and has helped hundreds of my menopausal patients go through menopause gracefully and ease the transition. Thank you. I'll see you in the next video.